Hi, and welcome to episode 10, documentation that defends you in court and at the board. So let me say something that might completely shift how you chart starting today. Your documentation is not for the patient. It's not for billing. It's not for insurance. And it's not for your memory. Your documentation is for the worst day of your career. It is for the attorney reading it 5 years from now. It's for the board investigator who has never met you. It's for the expert witness who is trying to decide if you were reckless or reasonable. And documentation is not a task. It is a defense strategy. And today we're talking about how to document in a way that protects you in court and at the board. Because minimal charting is comfortable, but comprehensive charting is protective. So let's talk about the myth of if it's not documented, it didn't happen. And you've heard it 1,000 times. And it's partially true. But here's the deeper truth. If it's documented poorly, it happened, and it happened badly. Short, vague notes don't protect you. They expose you. Patient tolerated well, treated per protocol, discussed risks. That means nothing in court. The question isn't whether you charted. The question is whether your chart tells the story of your clinical reasoning. So let's talk about what boards and attorneys actually look for. They look for 4 things: assessment, clinical reasoning, risk discussion, and follow-up planning. Not fluff, not copy templates, not auto-populated normal exams. They look for what did you do and why you did it. If you prescribed a medication, why that medication? Why that dose? Why now? What alternatives were considered? And what contraindications were ruled out? If that is not clear, the assumption becomes negligence. Not because you were negligent, but because your thinking wasn't visible. And here's the danger of copy-paste culture. EMRs make it look easy and they make it look thorough. Auto-populated exams, auto-filled normals, copied assessments. But when every note looks identical, it looks careless. And worse, it looks fabricated. If every patient has a normal exam, including systems that you never evaluated, an attorney will ask why. Think individualized. And charting with clinical reasoning is the key shift. Instead of writing, started GLP-1, labs reviewed, write, patient BMI 34 with failed lifestyle modification over 6 months. Labs reviewed, no contraindications. Discussed risks including nausea, pancreatitis warning signs, gallbladder risk. Patient understands need for follow-up and agrees to treatment plan. Now your chart shows indication, risk review, alternatives, informed consent, and monitoring plan. That is a defensive documentation, not defensive medicine, and there's a difference. So let's talk about risk conversations. If you didn't document the risk discussion, you didn't have it, at least legally. Document the black box warnings discussed, common side effects reviewed, rare but serious risks mentioned, patient questions answered, and patient verbalized understanding. You don't need a novel, but you need clarity because patients forget conversations. Paper doesn't. And follow-up is protection. One of the most common board criticisms is lack of appropriate follow-up. Did you schedule follow-up, recommend labs, provide return precautions, and document red flag education? Even a simple line like, patient instructed to seek immediate care for severe abdominal pain, chest pain, neurological symptoms, or worsening condition. That sentence alone can protect you. And documentation mistakes that destroy credibility. Let's talk about those landmines. Altering notes after notification, late entries without labeling them, missing timestamps, incomplete signatures, shared logins, and charting under someone else. Credibility is everything, and once credibility cracks, everything else weakens. Let's talk about chart audits. If you're not auditing your charts, someone else eventually will. Quarterly audits, random chart pulls, review them for clear assessment, risk documentation, proper consent, identity verification, and follow-up planning. You do not wait for a complaint to discover gaps. You discover them first. So let's talk about the mindset shift. Stop charting to finish. Start charting to defend. because every note should answer this silent question. If this patient had a complication tomorrow, would this chart protect me? If the answer is hesitation, add clarity. Documentation is not busy work. It is your silent attorney, because you worked too hard for your license to leave it vulnerable to vague notes. Clarity protects you. Consistency protects you. Clinical reasoning protects you. Not speed, not minimalism, not, I'll fix it later. Document like your future depends on it, because it does.